discussion revolves around the grounding requirements for a new lighting system operating at 70 volts in a patient care area. The core of the issue lies in whether this low-voltage system is exempt from the grounding requirements outlined in the National Electrical Code, specifically Section 517.13, paragraphs A and B. Let's dissect this. Section 517.13 A and B mandates specific grounding requirements for electrical systems in patient care areas to enhance safety and minimize the risk of electrical shock. This section emphasizes the importance of a reliable ground fault current path to ensure that overcurrent protective devices, such as circuit breakers or fuses, operate effectively in the event of a ground fault. Section 517.13 generally requires that all metal parts of electrical equipment in patient care areas that are likely to become energized be grounded. This includes, but is not limited to, lighting fixtures, receptacles, and other electrical devices. The purpose of this requirement is to provide a low-impedance path for fault current, allowing the overcurrent protective device to quickly trip and energize the circuit, thus preventing electrical shock hazards. Section 517.13b focuses on panel boards and enclosed distribution equipment within patient care areas. It mandates that these components be grounded to ensure a consistent and reliable ground reference point for the entire electrical system. This grounding requirement is crucial for maintaining equipotentiality and minimizing voltage differences between conductive surfaces in the patient care area. The argument presented is that because the lighting system operates at less than 100 volts, it should be exempt from these grounding requirements. However, the NEC does not provide a blanket exception for low-voltage systems in patient care areas regarding grounding. The code's primary concern is the potential for electrical shock, regardless of the voltage level. Even low-voltage systems can pose a shock hazard, especially in environments where patients may have compromised skin resistance or be connected to medical equipment. It is crucial to understand that the NEC prioritizes safety, and therefore it mandates grounding to mitigate potential risks. The NEC defines fixed equipment as equipment that is permanently fastened or connected to the building structure. Lighting fixtures, by their nature, are typically considered fixed equipment. They are usually mounted to the ceiling or walls and are intended to remain in place. The fact that the NEC specifically mentions luminaire as an exception number 2 within the relevant section further supports the argument that lighting fixtures are indeed considered fixed equipment. If lighting fixtures were not considered fixed equipment, there would be no need to include them in an exception related to grounding requirements. The assertion that the lighting system does not need to comply with 517.13 A and B based on its voltage or classification is incorrect. The NEC does not provide an exception for low-voltage systems in patient care areas. The code's requirements for grounding are based on the potential for electrical shock, and these requirements apply regardless of the voltage level, unless specifically stated otherwise in the code. Now let's talk about the grounding conductor. The insulated equipment grounding conductor, often referred to as the insulated EGC, plays a vital role in providing a safe and reliable path for fault current back to the source. This conductor is typically green or green with a yellow stripe to indicate its purpose as a grounding conductor. In patient care areas, the NEC generally requires an insulated EGC to be run with the circuit conductors to ensure a low impedance ground fault current path. The exception mentioned regarding omitting the insulated EGC above 7.5 feet and where switches are located outside the patient care area is a limited exception that applies only under specific conditions. It does not negate the general requirement for grounding in patient care areas. This exception is intended to address situations where the risk of electrical shock is reduced due to the height of the equipment or the location of switches outside the patient care area. However, even in these cases, other grounding methods may be required to ensure safety. To summarize the key points, firstly, the NEC does not provide a blanket exception for low-voltage systems regarding grounding in patient care areas. Secondly, 517.13 A and B mandates grounding for panel boards, enclosed distribution equipment, and metal parts of electrical equipment in patient care areas. Thirdly, lighting fixtures are generally considered fixed equipment and are subject to the grounding requirements outlined in the NEC. Fourthly, the insulated equipment grounding conductor, the IG, plays a critical role in providing a safe path for fault current. Now we should focus on the specific requirements of 517.13 paragraphs A and B. The representative's argument that the system doesn't have to comply with the code because it is under 100 volts is flawed. The code does not differentiate based on low voltage in this specific application. In patient care areas, the NEC prioritizes patient safety above all else. This is why the requirements of 517.13 are so stringent. The aim is to minimize any potential risk of electrical shock to patients who may be particularly vulnerable due to their medical condition. The phrase panel boards and enclosed distribution equipment shall be grounded from 517.13b clearly outlines the requirement for grounding. It is not open to interpretation based on voltage. Furthermore, the argument that the lighting fixture is not fixed equipment is also weak. If that were the case, the exception in the code that mentions luminaires would be irrelevant. The NEC is very specific about grounding in these sensitive areas. Grounding creates a low impedance path for fault current, ensuring that a circuit breaker will trip quickly in the event of a fault. This rapid response is crucial in preventing electrical shock. There may be confusion regarding Class 1 and Class 2 circuits. These classifications relate to power limitations and safety requirements, but they do not override the specific grounding requirements for patient care areas. Even a Class 2 circuit operating at 70 volts still needs to be properly grounded in a patient care setting. Consider the environment in a patient care area. There are often multiple pieces of electrical equipment in close proximity to patients. This creates a potential for leakage current and ground faults. Proper grounding helps to equalize the potential between these devices, reducing the risk of shock. The low current of the system is also not a valid reason to omit grounding. Even a small current can be dangerous, especially to a patient who may be connected to sensitive medical equipment. The NEC takes a conservative approach to safety, and that is why grounding is so important. The insulation requirements for the cable are also important. The fact that it looks like CAT5 cable is irrelevant. The cable must be listed and suitable for the intended application, and it must be installed in accordance with the NEC. The NEC may require the cable to be installed in conduit or have a metallic sheath for mechanical protection and to serve as a grounding path. It is important to remember that the NEC is a minimum standard. You can always exceed the requirements of the code, but you cannot go below them. In this case, it is always better to err on the side of caution and ensure that the lighting system is properly grounded. Now let's consider the role of equipotential grounding in patient care areas. Equipotential grounding aims to minimize voltage differences between conductive surfaces in the patient environment. This is achieved by bonding together all exposed metal parts of electrical equipment, as well as other conductive surfaces such as sinks, faucets, and bed frames. By creating an equipotential environment, the risk of electrical shock is significantly reduced. Even small voltage differences can cause microshock hazards, particularly in patients with indwelling catheters or other conductive pathways to the heart. Equipotential grounding helps to prevent these hazards by ensuring that all conductive surfaces are at the same potential. The NEC contains specific requirements for equipotential grounding in patient care areas, including requirements for bonding conductors, bonding jumpers, and ground fault circuit interrupters, or GFCIs. These requirements are designed to create a safe and reliable electrical environment for patients and healthcare staff. Now, let's address the argument that the representative is trying to make about the metallic sheath or raceway. The metallic sheath or raceway serves two important purposes. Firstly, it provides mechanical protection for the conductors, protecting them from physical damage. Secondly, it serves as a low impedance ground fault current path. In the event of a ground fault, the metallic sheath or raceway provides a path for the fault current to flow back to the source, allowing the overcurrent protective device to quickly trip and to energize the circuit. This is why the NEC often requires conductors to be installed in metallic conduit or have a metallic sheath, especially in areas where mechanical protection and grounding are critical. The argument that the system doesn't need a metallic sheath or raceway because it is less than 100 volts is not valid. The NEC requirements for mechanical protection and grounding apply regardless of the voltage level. The code's primary concern is to ensure the safety of people and property, and these requirements are designed to minimize the risk of electrical shock and fire. The exception for omitting the insulated EGC above 7.5 feet and where switches are located outside the patient care area does not negate the requirement for mechanical protection and grounding. Even in these cases, other methods of providing mechanical protection and grounding may be required. It's also important to consider the potential for future modifications or additions to the electrical system. If the lighting system is not properly grounded and protected, it may be difficult or impossible to add new circuits or equipment in the future. This can create safety hazards and code violations. By ensuring that the lighting system is properly grounded and protected from the outset, you can avoid these problems down the road. The installation of the transformer on the 4 square box above the light also needs to be carefully considered. The transformer must be properly grounded and mounted in accordance with the NEC and the manufacturer's instructions. The wiring between the transformer and the lighting fixture must also be properly sized and protected. It's important to use the correct type of wire and connectors for the application. The NEC specifies the types of wiring methods that are permitted in patient care areas. It's also important to ensure that the wiring is properly supported and protected from physical damage. Now let's talk about the importance of documentation. It's essential to keep accurate records of all electrical work that is performed in patient care areas. This includes wiring diagrams, equipment specifications, and test results. This documentation can be invaluable for troubleshooting problems, making future modifications, and ensuring compliance with the NEC. It's also important to train healthcare staff on the proper use of electrical equipment and the potential hazards of electrical shock. Staff should be instructed to report any electrical problems or safety concerns to the appropriate personnel. Regular inspections and maintenance of electrical equipment are also crucial for ensuring safety. Electrical equipment should be inspected regularly for signs of damage, wear, or corrosion. Any problems that are identified should be promptly repaired. In addition to the NEC, other codes and standards may apply to electrical installations in patient care areas. These may include state and local building codes, as well as standards from organizations such as the National Fire Protection Association, or NFPA, and the Joint Commission. It's important to be familiar with all of the applicable codes and standards and to ensure that the electrical installation complies with all requirements. The argument that the lighting fixture is not fixed equipment is not supported by the NEC or common sense. Lighting fixtures are typically mounted to the ceiling or walls and are intended to remain in place. They are therefore considered fixed equipment and are subject to the grounding requirements of the NEC. In conclusion, the grounding requirements for the 70-volt lighting system in a patient care area must comply with 517.13 MB of the NEC. The low voltage of the system does not exempt it from these requirements. The lighting fixture is considered fixed equipment and must be grounded accordingly. The insulated equipment grounding conductor must be installed in accordance with the NEC. The metallic sheath or raceway provides mechanical protection and serves as a ground fault current path. Proper documentation, training, and maintenance are essential for ensuring electrical safety in patient care areas. The NEC is the minimum standard, and it is always better to err on the side of caution.